Immediately after the oil spill, which was 2 years ago today, we began talking about the tremendous amount of need that was going to present itself on behalf of the affected community who lost wages as a result of the interruption of the ability to fish in the water, the drop in tourism, which led to layoffs and cutbacks in the tourism industry and the hospitality industry, and others whose livelihoods depended on the health of the Gulf waters themselves.
And there's hundreds, thousands of people that are been either wrongly denied or totally ignored and have no voice, or they have little claims and nobody will listen to them. There's a lot of hungry people out there. It's pretty sad.
Appleseed looks for structural problems that we can address the needs of vulnerable people at their root cause. And then when the BP disaster hit, it was really imperative that we get involved again, because so often the relief efforts are focused on immediate human needs and not always including the legal needs. So Appleseed, and through our Alabama office, Alabama Appleseed, were glad to participate with Martha Bergmark and the team from Mississippi Center for Legal Services, Mississippi Center for Justice, many coalition partners in trying to fix the many problems afflicting vulnerable communities throughout the Gulf Coast.
We provided assistance to some 6,700 people. We actually opened as cases about 2,900 of those, and so far about $13.5 million in claims checks have arrived on our clients' doorsteps thanks to our work. One of the key things about our work, I think, and our insistence that legal assistance from local programs like ours was so important, was not just the individual services we provided. As Ron said, we represented now about 6,700 people as of the end of March. But it was an opportunity to understand what was going on with the process and to interact with Ken and his staff to try to make changes in the policies and the procedures that he implemented. We also identified recovery needs that went well beyond the claims process, such as physical and mental health problems, foreclosures and evictions, bankruptcies, and issues with access to public benefits. And we continue to identify resources to enable us to address those issues as well.